Hello, I'm Dr. William. Most of you know me. This is a update and actually some revelations on the treatments of idiopathic canine epilepsy and idiopathic canine vestibular disease. For years and years and years, the term idiopathic has been depicted as a means to try to explain why we don't know the pathology of a specific thing or a disease condition. And the term idiopathic kind of drives me crazy because we actually do know what causes a lot of these idiopathic disease conditions. In the case of the canine, we found that we were able to utilize an adjusting instrument for these disease conditions and ameliorate the disease problem to some degree. And then when we started using lasers, for instance this laser, the old frequency specific laser, we were able to use both of them and actually come up with a relatively good response. However, it wasn't until recently, until we started using the new advanced laser, that we found out that we have actually a way to treat this, which means the pathology is not unknown. It's not idiopathic. Idiopathic means they don't know what causes it, but in this case it's caused by a vertebral subluxation complex. Now, the term subluxation complex indicates a bone's out of place, and that's not what a complex is. A complex is a neurological phenomenon that occurs with or without radiographic changes that you can see, but it's in the nerve, so you can't really see it on an MRI or on an X-ray. What the neurological phenomenon does is it causes vasoconstriction and skeletal muscle fixation, and in the canine, the area just behind the wing of the atlas is prone to actually a sponge-like activity. If you dissect this out surgically, you'll see this tissue behind the area of the wing of the atlas, in front of the atlas, in that area, that's really prone to subluxation or phenomenon, accumulates like a sponge-like activity of the byproducts of metabolic byproducts of subluxation, which are serotonin, bradykinin, prostaglandin X, prostaglandin C and B, also hydrogen ion, and a number of other pain substances that cause irritation. That irritation basically affects the neural lemma of the nerves that exit. And exiting in that particular area are all the cranial nerves that come right out at this location. And because of that, we end up with elevated amounts of inflammation that can produce all kinds of musculoskeletal problems, but also can fire off a nidus of electrical discharge that moves throughout the skull or throughout the CNS through the neural lemma and produces neurological phenomena such as seizure activity. And also, since that inflammation occurs in this area, it basically bathes the cochlear mechanism in such a fashion that it can cause what's called idiopathic canine vestibular disease, because vestibular disease, of course, is part of the balancing products of the cochlear area of the ear. Now, sorry for all that neurology and neurophysiology, but it's been worked out reasonably well. We wouldn't give you this laser update unless we realized that we're able to effectively apply this technology and ameliorate this disease condition. My own personal case, about 2 months ago, my 16-year-old dog rolled down the stairs just there, and she was kind of ringy for a couple of minutes, and then she started to have a seizure-like activity and nystagmus so severe that it looked like she had had a stroke and she was going to die. Well, she's 16 years old, and so we said, okay, this is it. And so we went ahead and I adjusted her and lasered her, essentially, and then she was so bad off at that time, we threw her in the car immediately and took her to my associate veterinarian who's here in town for a second opinion. And during that ride, it took about 10 minutes, she improved significantly, and so she started standing up and moving around, and then she continued to respond. The following day, she was 100% normal, which we suggested can happen for conditions of idiopathic canine vestibular syndrome. However, 2 weeks later, she did it again, and instead of taking her into the vet, we basically just lasered her and we gave her an adjustment, and within about a half an hour she was totally normal. And she was normal then for about a month. Did it again. We went ahead and lasered her again, essentially, and then treated her with a complete series of laserings, which was one twice a day for 3 days, once a day for 3 days, and once twice a week for 2 weeks, using this laser and only this laser, no adjustment. We basically put this protocol and we brought it up to the V's and went to vestibular syndrome, and the lasering was just like this for 60 seconds, and that's all we did. Twice a day for 3 days, once a day for 3 days, twice a week for 2 weeks. And so we would suggest that if we're trying to treat canine vestibular syndrome and canine idiopathic epilepsy, that this technique and this methodology with this advanced laser, because it delivers 16 different frequencies at one time, is going to be the state of the art for treating that condition. Now, this is anecdotal, okay? However, there have been at least a dozen other cases of canine vestibular syndrome we've successfully treated with this laser. We've only had this laser in the field for about 8 months, or 10 months rather. There's about 280 of them in the field right now, and they're getting used for this disease condition effectively. And it's our intention to basically give you this information now, because if you have one of those animals, these animals are very commonly, when they see this kind of condition, they're very commonly put down. And what we don't have to do now is we don't have to do that. We can apply this technology, and the success rate is significant. By significant, we mean well over 75%. Thank you for listening to this. This is an update on K-9 vestibular syndrome and also K-9 epilepsy, treated with frequency-specific laser of the LZ30-z program with a vestibular disease mechanism protocol, essentially available through Avant, but actually you have to order them through me. So if you have any questions, please feel free to contact me, and I can send you the materials that you need to actually do your due diligence on deciding whether or not this is something that you can use in your practice. Virtually every practice needs this. By the way, applications to human diseases that are idiopathic in this regard have not been investigated, and I wouldn't presume to do so, as I'm not a human licensed practitioner. Thank you very much, and have a great day.